all. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. So the discussion today is about a study from Tunisia about zinc. Zinc usage in COVID-19 patients, both outpatients and inpatients. That means hospitalized patients and non-hospitalized patients. Let's look at this study. So this is Drbeen.com. If you would like to have access to another 900 medical lectures, then you can use this link. It is in the description of this video. And for a very low price of $67, you can get access to all of these. It's a one-time fee. It's not recurring. Plus, within 7 days, if you didn't like it, you can return it. This is the study, twice daily, oral zinc in the treatment of patients with coronavirus disease 2019, a randomized double-blind controlled trial. These are some figures from it that we'll go over. And then there is one more collection of articles and mechanisms of the role of zinc, especially for the viruses. So zinc has many actions within our body, especially for the immune system. Number one. Number two, it is observed to be antiviral. Exactly what is the mechanism is actually not very well known. Thirdly, about 17 to 20% of the population is zinc deficient. That means their immune system doesn't really work as appropriately and correctly as it should be, just like vitamin D deficiency. So let's look at the discussion now with my beautiful diagrams. So let's start. So oral zinc can decrease 30 days death, ICU admission rate, and shorten symptom duration. That is the conclusion of the study. Although the death rate in both cohorts was the same, however, you would see that there are huge differences in terms of hospital length of hospital stay, or the severity of the symptoms, or admission to the ICU. And of course, you'll be thinking, what was the zinc that they used? So they used 25 milligram capsules twice daily and elemental zinc. What was the result? So here, let me actually show you the results so that if you wanted to take a screenshot, you could, and I would appear there as well here. So 30 days zinc mortality, 30-day mortality. That group that was on zinc, they had 6.5% mortality. Placebo group was 9.2%. Odds ratio was 0.68, although p-value was not significant. Then ICU admission rate. Zinc group, 5.2%. Check this out, 5.2%. And placebo, 11.3%. So odds ratio was 0.43. That is actually very interesting. And this was significant data. Then combined outcome. That was the primary and the secondary and the symptoms. Lower in zinc group. And we'll look into that. Again, statistically significant. Length of hospital stay. 3.5 days lesser in the zinc group compared to placebo, statistically significant. Duration of COVID symptoms, 1.9 days lesser in the zinc group compared to the placebo. Once again, significant. So clinical outcomes become even better after 15 days of usage. So you'll see the data here that the clinical outcomes, you'll see at 15 days, they just start becoming better and better. And it seems like, to me, it may be because of the deficiency. So 15 days of continuous zinc usage probably restores the normal levels, and then the body starts, an immune system starts functioning better. So please, especially during these holidays or any time when you're traveling or coming in contact with others, have your nasal spray and have zinc. Vitamin D levels should be good. And I have a bunch of other supplements as well that I've discussed in the past. Nasal spray is amazing. I used to get COVID very often. This happened. And since I've been using Cofix RX, and I have no commercial interest with them, I have no commercial interest with them. I don't get any commission. I do not. This is the Cofix RX. This is actually 1.2% povidone iodine, and I use that in my nose before exposure, after exposure, and I have never gotten COVID again. That may be because my body is now well protected after multiple COVIDs, but the COVIDs that I had were I believe in March, April. Since then, I have not, and this, I believe, is very important. Okay, so continuing. So before the details, here are some things that I do. And this is not a medical advice. This is not a suggestion to do something. Please talk with your doctor. Everybody has a different body, different status, different diseases, different nutritional statuses, different supplement levels. So something cannot be generalized for you. So I really, truly am saying that please talk with your doctor, see what is necessary for you or not. I use povidone iodine as I just showed you. This has made a huge difference. Vitamin D, magnesium, K2, MK7, zinc with quercetin. Remember, quercetin is an ionophore for the zinc. So when the zinc has to go into the cell, the quercetin can help. And remember, we also discussed that zinc possibly disrupts the viral enzymes, the RDRPs. So it has to get into the cell, and quercetin helps with that. I use M&M as well, resveratrol too. I use like religion, MCT oil, coconut oil, black seed oil daily. Okay, continuing. Study details. So we have already seen now that the study is using zinc twice daily for COVID management improves the patient's situation. So let's see some details. So first of all, the study name was Viral Infection Treatment with Oral Zinc, or VIZIR. Great name, VIZIR. Was a prospective, randomized, prospective. So it was going forward. It was planned study. It's not an observation. It was not retrospective. Prospective, randomized, double-blind, placebo-controlled, multi-center trial. So all the correct check marks for a good study are here. And I believe their data size was correct as well, or good as well. It was done from February 2022 to May 2022. So latest variants. And this is the interesting part of the vitamin Ds or zincs. They don't care for the variant because they work with the immune system. They work with the directly attacking the viral enzymes. So they don't care what is the spike protein like, which is today versus yesterday. The protocol was approved by the Institutional Review Board of all the participating centers. The VIZIR study was carried out in Tunisia in 3 Tunisian university referral hospitals. Okay, so continuing. And my point, where I do not go in detail for every single thing, is that I want to bring in enough highlights from the studies that then hopefully that piques your interest and you go and read the whole study and see the strengths and the limits and the data points. So, all right, so continuing. Participants were 18 plus. Total were 470 for the intention to treat. They started with 1,200 and they kept excluding, and finally they had 470 that were in the study. Out of these 470, N is to 30 for the zinc group. So this group, so all of them got paracetamol, not all of them, depending upon the need. If they were not symptomatic, then not. So paracetamol, steroids, anticoagulants, and oxygen was the standard therapy or adjunct therapy. And over here, there are percentages for how much percentage various folks got, or what percentage of the patients were receiving that therapy. So then in addition, there was 231 patients who were given zinc twice daily, 25 milligram. And then there were 239 patients who were given placebo. 190 were outpatient. That means they were not hospitalized. 280 were hospitalized. The most common comorbidities in these groups were hypertension, that was 23.4%, and diabetes, that was 19.4%. Mean age, this is important, mean age 54.2%, 54.2 plus minus 17.3. And gender, 47% women. So it is actually interesting, they said 53% men. And I realized that in all studies, we always mostly report men's percentage. So today I decided that I'll report women's percentage. So 47% were women. Outcome criteria. So they have, of course, primary and secondary outcomes that they were working with. The primary outcome was death rate. And to be candid, their primary outcome was not statistically significant. 6 point some percentage of deaths on the zinc side and 9 point some on the placebo side. So there is numerical difference for sure, but that was not statistical difference because of the sample sizes. So they didn't meet their primary outcome, I believe, because of the smaller sample size. ICU admission rate and combined outcome within 30 days after randomization. So in the ICU admission, they were actually statistically significantly better on the zinc side. You would see that almost twice was the rate of ICU admission in the placebo. And similarly, the combined symptoms outcomes within 30 days were also lower on the zinc side. Secondary outcome was the length of stay in the hospital. That was also zinc statistically significantly better. Then also the symptoms sets and their length, the length of symptoms, that was also better on the zinc side. So all around, it actually did very well. And this is something that we can all do. So make sure that your zinc levels are correct, especially during the holidays. So here is a figure that they have, which is very interesting. So this figure is called a forest plot. You have seen it many times. So in here, there are various outcomes, then zinc group here and the outcome in them versus placebo group and the outcome in them. And then here is the forest plot. So if the plot is in this column, then zinc is better. If it is in this column, then placebo was better. If it spans both, then it was insignificant. So let's very quickly. So the way they had looked at the symptoms, they were grade 1 symptoms. Grade 1 meant no symptoms. Then there were grade 2 symptoms. Grade 2 meant without the need for oxygen, but more management required or hospitalization required. Grade 3 meant need for oxygen as well, in addition to other managements. So if you see here, this is very interesting. Look at the grade 3. Grade 3 was squarely in the zinc benefit side. And if you see, the confidence interval range does not cross the unity, so it was statistically significant. And look at the odds ratio, 0.39. So 60% better. So similarly, grade 2, if you see here, not much benefit in the grade 2 symptoms. So this is one forest plot. It is interesting from, look at this, inpatient patients, the severity in the combined symptoms, 3 versus 12. And if you see here, data is significant as well. Time since symptoms, it crossed the unity kind of, so not significant. This one is not significant. Here, this is significant. Age greater than 65 years of age and COVID positive, if given zinc, they have better outcomes compared to placebo. Lesser than 65 years of age, their outcomes were not statistically significant. Male gender, not significant. Females, not significant alone. The reason, the sample size was very tight. So any deviation would just, any subgroup that became small for any reason, age, gender, then data would fall apart. Bigger studies are expensive, take more time. So usually the researchers try that they have the tightest most group that can prove, that has, as we call it, enough power in the study to be able to prove the data outcomes that they're looking for, or have enough people to reach towards that proof. But if the sizes are bigger, then it becomes even better. Okay, so this is a beautiful plot. Then here, this was really amazing. So this is within 30 days. So 0 days or baseline, 15 days, 30 days. So if you see here, this is baseline. Then 15 days, then 13 days, 30 days. And what? The severity. So the first, let's start from the baseline here for zinc group, for example. In the zinc group, on the baseline when the patient was received, and patients were included within 4.6 days of the symptoms. They excluded anyone that had symptoms for more than 7 days. They thought it was just not the correct time to start them in the study. So at the baseline, 5.6% of the patients were asymptomatic who started zinc. 34.2% were grade 2 who were given zinc. And then 60.2% were grade 3, needed oxygen. This was at the baseline. Today, and look at the day 15, what happened. Now you're giving zinc. That is the only difference from the other group. On the day 15, look at the severe cases percentage. That actually reduced from 60 to 46.8. And asymptomatic patients increased from 5.6 to 22.1. That means the virus clearance started occurring faster. And then on day 30, look at the severity, 13.5. Grade 2. So 13.5 is the grade 3 severity, highest severity. Grade 2, 22.2. And look at the grade 1, asymptomatic by 30 days, 64.3%. Now it is even more interesting if you compare that with the placebo group. Check this out. Now let's go to the bottom line here and here. This is the baseline, the very first day. If you see here, they both are kind of balanced, similar. For example, on the day 0, the zinc group was 5.6% asymptomatic and 5.9% asymptomatic, the placebo group. Then 35.1% placebo group were grade 2, 34.2% of the zinc group were grade 2, so very similar. And then 59% were the grade 3 in placebo and 60.2% were grade 3 in zinc, so very similar. So both the patient groups started almost very similar. Then look at 15 days. At 15 days, 9.7% in the placebo became asymptomatic, meaning they didn't have symptoms anymore. Or they rose from 5.9 to 9.7. 15 days, zinc went from 5.6 to 22.1. Then look at the severe side. Day 15 placebo was still 60. Actually, it increased from 59 to 60.5. On the zinc side, it decreased from 60 to 46.8. I would love to be in this group where the severity is reducing. And then at 30 days, the severity in the placebo went down, or the grade 3 severe patients went down to 23.1%, and on the zinc side, 13.5%. Isn't this interesting? And the placebo side, the asymptomatic were 49.6% at 30 days. In zinc, 64.3% at 30 days. I love it. Okay. Then, this is their table number 2. Various outcomes, primary outcomes, and their data. So death or death rate. So 15 in the zinc side, 6.5%. 22 on the placebo, 9.2%. Numerically better. It was a 40% reduction in death on the zinc side. However, statistically not significant because the p-value was 0.27. Okay, ICU admission. 12 on the zinc side, 5.2%. 27 on the placebo side, 11.3%. 11.3 versus 5.2. And significant. So once again, I would love to be on zinc so that I have lesser chances to end up in the ICU. Then composite outcome, multiple symptoms together. 24 or 10.4% on the zinc side and 40 or 16.7% on the placebo side. Statistically significant as well. Very interesting. Now, the discussion of the mechanism. It's really not clear how. For example, we did discuss, so if you search in my channel about magnesium and zinc and vitamin C and D, you'll find them. I had done this discussion about zinc, that zinc actually disrupts the RDRP's function. However, zinc need to get into the cell, and zinc is a positive ion. So zinc needs zinc ionophores, and that quercetin is one very important one. And quercetin, you can buy pills or capsules, or quercetin is also present in red-colored, red-skinned vegetables and fruits. So onions, red onions have lots of quercetin in them. Red bell peppers, or these red fruits, apples, red apples. So quercetin and zinc are kind of hand in hand, they work together. Now, the researchers say, to our knowledge, this study is the first well-powered, had sufficient people in it, placebo-controlled clinical trial to report results of zinc for the treatment of patients with COVID-19 when administered orally to patients hospitalized with COVID-19 without end organ failure. So these were all excluded. Anyone who already had the end organ failure or was already that severe, they were excluded. Without end organ failure, zinc demonstrated its efficacy to prevent ICU admission and to reduce hospital length of stay for outpatients. Zinc reduced symptoms duration. Zinc should be considered for the treatment of COVID-19 patients. And then in summary, oral zinc treatment for 15 days is associated with a nearly 40% reduction in death and ICU admission. With shortening of symptoms duration in patients with COVID-19, our results have very important clinical relevance in the absence of specific effective curative treatment. Beautiful data. Loved it. So if you combine the Luffy and the vitamin D and the zinc and the Cofix RX, generally a good immune system with all the other cares, whichever cares you feel and your doctor feel are right, those cares, I think we can be okay, or we can be better than if we didn't do those things. So with this, thank you very much. Stay safe, happy during the holidays, happy Hanukkah, happy Kwanzaa, happy Christmas, happy New Year, happy hour, and other happy things to you as well. And if you would like to support this work, there are links in the description. You can buy me a coffee, or you can use PayPal to support this work, or you can become part of patrons. I would love it. It's just $5 a month, and you go there and you vote for the topics, and you see the studies before. For example, I had posted this study there before today, before this talk, etc. So you can support this work in general for humanity if you like. So thank you very much, and I would see you again. My hope is that after this talk, we take 4 or 5 days off. So please tell me, would that be okay? That we maybe meet next week a couple of times, and then maybe in the new year. So with this, thank you. Stay blessed. Bye-bye.